The next remedy, phosphorus, is phosphorus again feels that something will go wrong, and this he generally feels when he hears others' pain or others' sufferings, or when he meets people or his friends where he observes that they are suffering. When he sees that, then Phosphorus becomes anxious, and in fact, he starts experiencing the same symptoms that the patient has. So, for example, if Phosphorus patient went to meet a patient at hospital who has paralysis, so by the evening when he's coming back home, he starts feeling that he is having a paralytic attack. That is how Phosphorus is very uh, affectionate. He gets affected uh, by what he sees. He's very sensitive. He's very sensitive to what he sees, and he's impressionable. So he sees that, and he it just like enters his body, and he's now feeling that, and he's feeling the pain, and he's feeling the whole emotion that the opposite person is feeling, and he feels very bad for that. He's then From that comes his sympathy, where he really feels for the other person and wants to do something for the other person. And in that um, sensitivity, from that sensitivity comes his anxiety about the pains and sufferings of others as well as himself. He feels, oh, this much of pain this patient has, oh, maybe I will also have, oh, maybe some others will also have, oh, I can't feel, oh, it should not happen, it's very painful. Hmm? So they think, and they start feeling that what others are having, someday they will also have. They will also have to suffer that kind of pain or suffering. And they actually also start suffering from it. But the main thing, another important thing of phosphorus is when they are feeling this pain, and when they become anxious, oh, now what is going to happen to me, no, now let me go to the doctor, now let me meet the doctor, now let me do this, now let me do that. In all that anxiety, if someone just catches hold of phosphorus and just pacifies him and tells him that I am there with you, your pain will be gone, phosphorus pain actually disappears. They are also very uh, much ameliorated by the love and affection of someone else. If they meet a doctor who talks with them in a very nice manner and assures them that there is nothing wrong with you, you will be completely all right, phosphorus anxiety disappears. So that is how phosphorus anxiety is. It is, he's very anxious, but somebody who from his relative or somebody whom he trusts or some doctor tells him with full confidence and trust that you will get better, phosphorus patients get better. Right? Now, the next remedy is sorinum. So in Sorinum, again, there is this bad feeling, and in fact, Sorinum is a nosode, and all of us know that all nosodes have this feeling that they never get well, never well since that illness, or always feeling that something bad is going to happen, some kind of bad omen, something is wrong here. That is Sorinum, right? So Sorinum is is like uh, you know bad omen. Kuch some bad thing is going to happen. How do I put it? That so the most common example for Sorainam would be of a woman who was, who was earning like, 3 4 lakhs a month. She was doing really well. She had very good job, very good money, and everything was stable. She had her own house, she had everything going, her husband also earning well. But her main thing was, I am doing so well, I have so much money, but still, I feel this is not enough. I will lose this money. Some bad thing will happen tomorrow, and I will lose this money. All this money will be gone, and then I will be having nothing. So constantly, even after having such good job, I always feel that I need a better job with more money, with more. So like I told in the previous videos also about Sorainam, they always feel how much ever you give, it is not enough. They always feel they are poor. Even after becoming millionaires, Sorainam has this perception that he's poor. I am poor. I'm still not earning well. I'm still poor. Maybe tomorrow I will go bankrupt and everything is gone. One bad incident will happen. One bad incident will happen. This is how Sorainam is. And they feel then they will not be able to come out also. It is nosodes are desperate because they feel hopeless about situation. One bad incident will happen and I will never be able to come out of it, never be able to recover from that financial setback. Hmm? So actually he is not poor, anticipating, thinking, oh, bad is going to happen, bad is going to happen. Hmm? So that is what Sorainam is. So let's move to the next set of remedies, right? So the next set of remedies, the next remedies are, yes, nitric acid, cocculus, silicia, carcinosin, and calcarea carb. So nitric acid. What we should remember well of nitric acid is they are always discontented, unhappy people, discontented, never satisfied. So these are patients who will go to allopathic doctor, who will go to specialist doctor, who will come to homeopathic doctor, who will come to ayurvedic doctor, who will go to acupuncture, who will go to Unani, who will go to all therapies, and they will be satisfied with no one. They will do all the investigations that the doctors tell them, but in spite of the doctor telling them that there is nothing wrong in your report, everything is good, everything is okay, you don't need to worry, you can just forget about your health, still nitric acid feels, no, no, this doctor, no, he was not good, I think I need to find some other doctor. Then they go to another doctor, then they do all investigation with that doctor, then they ask, now what, tell me, what illness do I have? Nothing. No, not good. I am having pain. I am having suffering. How can you say I have nothing? I have so much. So they feel very, very dissatisfied and they will tell you that I met so many doctors. Nobody is able to find a solution for me. Nobody. And I am roaming since the last 2 3 years. I'm getting frustrated. So one of the main rubrics of nitric acid is delusion like he's in a lawsuit. So if it, for example, if in India we file a court case, that court case seems to run for years together, 10 years, 15 years, and slowly then we become hopeless and we become frustrated about the functioning of our courts and of our government and of our institutions, and they become very, very hopeless, dissatisfied, discontented with the manner in which everything is functioning, and then they want to rebel and then they want to fight and then they don't want to follow any rule and regulation. All these rules and regulation are crap. Nobody gets punished who does wrong. That is how nitric acid is. That all this so much of efforts that I am putting in for my health, doing so many investigation, meeting so many doctors, all this is all in drain. Nothing is working well. All these doctors, they are waste. Forget these doctors, I will have to find something else now. Something else. They find something else, again something else. Never get contented. They are discontented, and their main fear is, I will get some big disease, I will get cancer, I will get infection. Worried and wanting to break free, break all these, normal ways of finding solutions to illnesses and find something different. That is what nitrogen is. No, it feels constricted, confined and limited by this, by the knowledge of these doctors, by the knowledge of these investigations. This is limiting for me. I have to now, because not able to find solution from this limited, I have to break free and find solution from the unlimited. So I want to rebel, so I want to fight, so I will show my discontentment to the doctors, everybody, to my family, everybody. Very anxious, nitric acid. They lose sleep, sleeplessness, ailments from sleeplessness because of worrying about health of myself, and also because of taking care of someone in the family and seeing again they feel the same thing. Someone in my family is ill. We met so many doctors, so many physicians, so many investigations, nothing is happening. Very discouraged by that. This court cases for so many years, nothing happened, no result come, everything is waste. That is how nitric acid feels. Huh? Next remedy is cocculus indica. Cocculus is similar to nitric acid in some ways, because cocculus also has ailments from loss of sleep, because cocculus also has ailments from anxiety for others. So typical cocculus situation is a situation where, you know my mother or my father fell ill, and doctor, we investigated and we found out that she had cancer. So I was so worried. Now what will happen to my mother? Oh, will she will live? Will she not live? What will happen? What is this cancer? What is this? Why is this happening? Now what will happen? Now what will happen? Will she live? Will she not live? What will happen? Very anxious. Now that something is going to go wrong and I may lose my mother. And cocculus develops ailments when, after this diagnosis, they say that I was so worried, I was so anxious for my mother, and on top of that, I was with my mother for the whole month, taking care of her in the hospital. Whole day I was there, whole night I was there, taking care of her, giving her food, doing all kinds of things. So I overexerted myself. I didn't even sleep properly. Even if I would get time to sleep, then I would very anxious. What will happen to my mother? What will happen to my mother? From that anxiety and worry, along with loss of sleep and overexertion. This overexertion is also important. Not sleeping, working 24 by 7 for 1 month, 2 months, and after that I fell ill. This is cocculus. That is why then the symptoms are feeling very drowsy, feeling very sleepy, wanting to sleep. If I sleep, I feel better. Vertigo, giddiness, not able to grasp things because my mind and body is completely exhausted now. Even after reading the books, I am not able to understand what I am reading because my whole body mind has now exhausted itself. It's not able to function anymore. So it is also known as bookworms remedy. People who are reading, working, girls who are reading for 10 hours, 12 hours a day, but they get very few marks in the exam. Why? Because nothing is going inside. I am feeling so drowsy, so sleepy. I was working so much. After that, then I had exam. But for the exam, my body and mind is not ready. It is feeling sleepy. It is feeling drowsy. It wants rest. Hmm? So that is how calculus is. Ailments from anxiety, worry, and loss of sleep and exertion. The next remedy is silicia. So in silica, what we find is that they are very concerned about how people look at them, how people perceive them. So to give you an example, I remember one patient. She was very anxious that I should get good marks in the exam. I have an exam tomorrow in my school, and I should get very good marks. Last time I didn't score well, so my teacher said, "Are you always score well? This time you did not score. So this time I want to make sure that I score well." But I become so anxious that I should do well, that sometimes when I am writing the paper, and suppose there is a word in the answer that says can, and in that can, the alphabet A is slightly above. When the teacher was writing on the board, maybe the chalk broke or something happened, and the A went above, and then the N came back along in the line with C. So I am so worried that it should be exactly in the manner in which teacher had written on the board, or exactly in the manner that is given in the guide, that I consciously write the A up and then the N down. Because I feel if the teacher sees it in exactly the manner that she has given us in the school or in the lecture, then she will give me good marks. So that is what silica is. They feel that they have to be very, what you see, exactly replicate what is expected of them. My teacher expects that I should be this, I should write the answer in this exact manner, so I will write it in that exact manner. I will not change. So my father feels that I should become doctor, so I will become doctor. Why? Because everybody in the surrounding tells that you are his son. He's a good doctor, so you should be of his level, of his standard. So I have to maintain my family's standard, my family's image in society. For that, I have to function. I have to be like my father. I have to dress like my father. I have to look like my father. I have to talk like my father. I have to have my mannerisms like my father. Because that is what people expect of me. You are his son. You should be like him. And when suddenly one day the the father is not there, or that person is not there, and I have to now maintain that image of family, then I become anxious. Or there is an exam where everybody is saying, now this is MSET exam, now we will know whether you will become a doctor or you will not become a doctor. That exam becomes most anxious for me. Today is the day where everybody will know whether I can live to the standard of my father's image. That causes too much anxiety in silica. So there is lot of image consciousness in silica, and this need to maintain that image causes anxiety. Next remedy is carcinosin. So in carcinosin, again you see lot of feeling that something bad is going to happen, because it is again a nosode like sorinum. But in carcinosin, they feel that they have to be in control of their anxieties, of their worries, and they have to take charge and they have to help others. They are more worried about others. In fact, carcinosin is worried about elders also, that if I show that I am anxious for the exam or I am anxious for this thing of mine, then my parents will become worried, then they will have problem. So instead of that, I should only be under control and be well mannered. So it is precautious. They are mature than to their age. It is a small child, but he is more worried of his parents rather than himself, rather than his own exam. What will my parents feel? What will my parents go through if they know that I have anxiety? So that is carcinosin.